trauma is not about an event. Trauma is about when there's too much going on too fast for us to be able to integrate the information.
Welcome back, everyone, to the Integrative Women's Health Podcast. I'm your host, Dr. Jessica Drummond, and I'm thrilled to be here with Julie Cardoza. And we are going to dig deep into the intersection between physiologic health of the quote-unquote body versus health of the mind, particularly for women in perimenopause. And we're going to break down some of those distinctions. So welcome, Julie, and please share with our listeners the kind of work that you do.
Hi, Jessica. I am a licensed marriage family therapist, and I practice from a holistic, integrative perspective. I also am a specialist in trauma, in working with the nervous system. I am what's called an EMDR therapist and an EMDR consultant. And if you're not familiar, EMDR is a mouthful. It's eye movement desensitization and reprocessing. And it's really a specialization within working with trauma. So I work a lot at the intersect of trauma and health and women and midlife, and now also offering the coaching.
So Julie's a graduate of our perimenopause and menopause training. And I'm curious what, a lot of what we teach really overlaps with that. This idea that we have to have a regulated nervous system, that we have to have physical tools, which EMDR is sort of a physiologic tool to help access calming and learning to regulate the nervous system. So what got you really curious and interested in joining our perimenopause training?
It's interesting as I started to hear more of menopause education really coming into the forefront. This year, I had already been studying it a lot related to my own journey, which was related to surgical menopause. And so there's a whole other kind of link there, and in really working with understanding trauma and the trauma that happens within that. But as menopause started to kind of get more attention this year, and as we've, kind of had more media coverage, I started to dig in a little bit more in what's out there on holistic, integrative mental health and trauma. And I did not find a lot of quality education or training that really came from a more holistic perspective, whole body perspective. And I was really surprised how little conversation there has been within the mental health field. So when I couldn't find it in the mental health field, I thought, well, hey, let's do this program. And that's what led me into doing the integrative health coaching program.
Yeah. And I think what you probably found is that from my perspective and our whole community's perspective, mental health and physical health can't be so abruptly separated. And I think, your story really aligns with that, right? You had a surgical physiologic menopause, which is a fairly abrupt experience. And you didn't just have physical symptoms. You probably could notice, especially given your background, any even mild shifts in your mental health.
Yes. And, it just is really, again, surprising because we don't talk about it in mental health. And we know you cannot separate physical and mental health. But we aren't really educated to think about it.
Yeah, well, that's what we're here for. So if you're a practitioner in mental health and you're listening to this interview, we're going to help you make those connections. And I think everything you bring from your background, it's still wildly valuable and your own personal experience. In fact, all of our students, not all of them, but many, many of our students do come to this through their own personal experience, whether they're most bothersome symptoms are mental health, physical health, both, somewhere in between. That's the thing about perimenopause and menopause. One of the things that we really emphasize is that almost no one, the data is about 85%, but I think that's even kind of an undercount. Almost no one shows up at perimenopause, somewhere in their, late 30s to mid to late 40s with absolutely no underlying health stressors, right?
Mm-hmm.
And so we see that in the world of mental health, that even, for example, postpartum depression, if it was 10 years ago, can sort of be shaken up again, or issues that maybe originally presented in puberty can be shaken up again in the hormonal shifts of perimenopause. Is that something you see in your practice?
Absolutely. Again, really unnamed. And as I've been digging in more and starting to look at the intersect of ACE scores and how that impacts menopause transition and midlife, and like you're naming, as far as when we've also come through these other major life transitions, like how the stress shows up in our body, how the HPA axis, the stress axis in the nervous system has already been primed to already run so high in stress, in sympathetic mobilization. And really is, as we all know as well as women, we also push through and perform and have really no idea both how the psychological changes of midlife as we're forming new identities and this kind of primed nervous system towards sympathetic activation or mobilization, and how old traumas are going to surface, grief is going to surface, and the stress of that identity transition and threshold is also going to surface.
Yes. And I think women are starting to have these conversations, whether it's in their own lives or on social media, that there's this almost like a caricature of a woman in her late 40s who's like, I'm done. Don't ask me to do anything anymore. I don't care about anything anymore. Women are getting divorced in droves. They're just like, you're a teenager, you're on your own, or they're kind of like throwing their hands up in this almost caricature type way. And I think it's really just because so many things come together at that time. Like you're saying, the psychological shifts, the identity shifts. And if you've been really kind of doing all the things to manage both your stress, but also your metabolic health, like you've been exercising, you've been trying to eat well, you've been getting a decent amount of sleep, some of that scaffolding starts to physically fall apart when the estrogen levels generally decline, but they're kind of all over the place in the short term. So you lose the little bit of like support physiologically that you had. So if a woman shows up in your practice and she's like, things are on fire, I'm a mess, I just don't care anymore, I'm just enraged, where do you begin?
I like to talk about the menopause and the physical component, and I educate women so much around, because we don't feel empowered. We're isolated in so many different directions. And again, thinking of kind of what's happening on that physiological level. Um, how are your periods? What symptoms are you starting to see? Do you even know there's symptoms around perimenopause? When I had my surgery several years ago, we still weren't even really using the term perimenopause. We're primed towards identifying, oh, if my periods are really intermittent, maybe then I might have some of these big symptoms. And we've really got to back it up quite a bit more into that transition, even around 40, and starting to be able to have the conversations and identifying, do you know how to track your period in some new ways? Also looking at mood, also looking at energy, also looking at sleep, also looking at what are areas of your body that are beginning to show pain. What is going on with your metabolic health? All of those are messengers about starting to understand, what is my body letting me know, which is really challenging. By the time people come into mental health, they're usually um, pretty desperate to be heard. It still has a level of stigma. And if we don't understand what's going on in our bodies, of course, we're going to just try to get rid of the marriage, get rid of this, get rid of that. Like, what is this stressor? I don't know what's going on. Like, I must need some major change instead of, we look very external instead of understanding what is my body letting me know? What's my body actually telling me? What are those signals? How is this impacting those relationships? And now where do I need to make some adjustments? So I actually am one of the few clinicians that will ask about, menopause and perimenopause and hysterectomies and what type, et cetera. So a lot of times that's where I start.
Yeah, I think that's so valuable. And I really do think we need a much larger sort of army of practitioners in the mental health space, because I think what you said there is so important, that what women do is they wait till they're desperate and then they hit the wall. And then they make a big change. They quit their job, they get divorced, they, blow up at their family and their loved ones. And sometimes because they haven't slowed down and really examined. Now, yes, usually there are other problems. There are problems in those relationships. There are problems with that work experience. There are problems with their relationships with their family members that do need some work. And sometimes, making a job change, getting a divorce is the right next step. But I think when it's done from a place of desperation, it actually, if we circle back to what we were talking about in the beginning, it adds a layer of stress.
Right. And it's really the nervous system communicating flight pattern, right? It's really in more sympathetic activation. And, she said something in there that's the biggest challenge for women. If we slow down enough to listen. And in midlife, that's hard. We're busy. We're raising kids. We've got maybe a teenager, maybe one in college, maybe one still even in middle school. We're all over the place. We're starting to see our parents age, or maybe we've already lost our parents. We're working with career dynamics, and often at the peak of our careers. We don't want to slow down.
Yeah. And sometimes not even that we don't want to, we can't, whether it's financially or, and we now even have more women having babies in their 40s than their 20s, at least in the United States, but I think in the EU as well. So you might be literally having a toddler.
Exactly.
Yeah. And not to say teenagers are necessarily easier than toddlers, so having had both. And even people who don't have children, I think, like you said, you're kind of at the peak of your career, but you also might be taking care of a lot of other people, animals, you're the caregiver at work, you're a caregiver at home. And, you know, the data is such that a lot of women don't have a lot of financial flexibility at this point because they have kind of stacked, even if they have a good income and they're at the peak of their careers, they have a lot of responsibilities, whether it's, school debt or family caregiving. So I think putting it into context and working with someone like you that can help them navigate this over time rather than making a desperate choice that actually adds another plate to their spinning plates is, I think, really where it starts, because you're 100% right. This is exactly what I see in my practice as well. It's like, if I could give 100% of my clients the prescription of just rest for 1 month, and then we'll see. There are occasions where I've actually done that because the situation was so physiologically problematic that we had to really get to that level of radical rest, if you will. But yeah, that's so hard. So talk about in your practice, like give me kind of a case example or a amalgam of cases of what that looks like. How do you start?
I'm a little newer in kind of taking the perspective, but I would say A lot of times I'm exploring, is it burnout, right? What's going on and looking for, is there burnout happening, right? Is that exhaustion starting to set in? Is it a recent trauma? It's so rarely a recent trauma. I was just listening to another podcast this week about just how rare a single event, post-traumatic stress disorder is. And so often, coming from a more somatic point of view, I'm just starting to look at what's activating the nervous system. So I don't really want to take a deep dive into the trauma immediately. I just kind of want to know and name. I'm always curious what's been going on health-wise, and we were just talking about this before we started the podcast, because I'm really listening for all the fragments and piecing them together. And so often it's I'm also busy because I'm going to this doctor for this issue. I'm going to this doctor for this issue. I have chronic pain and I'm, in XYZ programs and therapy. They're just to really sit down and look at the whole picture and feel heard. That's the number one, to reduce the isolation, because the isolation is so activating to the nervous system. And we know that number one healing component is being able to start to be heard and to be implicitly accepted no matter what it is you're dealing with.
I love that. It's exactly in alignment with what we teach because, we're always optimizing this program and our programs in general because we hear from both practitioners and also people living with these challenges. And one of the biggest thing that our clients ask who have a lot of complex challenges, exactly what you said, they have depression, anxiety, but they also have chronic pain, autoimmune issues, chronic fatigue, dysautonomia, whatever it is. And the what they're asking for often in their coaches is, can you help me? Can you help be the person to help me organize all of this and maybe take a few things off my plate? Because sometimes they can get to that point where they're actually almost afraid to go to their primary care doctor because they're just going to recommend like another thing to do, another specialist they have to see, when actually we can often sort of strip things down when we slow down and listen.
And I get so many referrals that are from like primary care physicians. And I've gone through this myself. A lot of this has been a part of my own journey and things that I am now dealing with because I had no idea. Doctors don't take a holistic point of view. But so many people come to me in the sense of, well, my doctor says this must be all in my head then, right? And I'm like, yes and no.
Yeah. I mean, it is kind of in your brain.
Your head.
Yeah, it is sort of all in your brain. Absolutely. Yeah.
The brain is the control center, and it is like reading all the messages of the body. But that does not mean it's not real. And that does not mean there is not real physiological, systemic issues going on. And so often it is. But again, it's that place to be, where it's like, can I sit and be heard? Can I listen to myself? Can I start to have some of those aha moments that you're like, oh, now I'm piecing this together and can hear even just the cohesive thread. So when I hear that cohesive thread, I'm empowered. I'm empowered to start to take care of myself rather than, maybe feeling more shut down or embarrassed or uncertain, confused, which we know confusion is so much of the trauma marker. That's when the nervous system is overwhelmed. And it's really coming from a perspective that trauma is not about an event. Trauma is about when there's too much going on too fast for us to be able to integrate the information. And so it's really about that integrative aspect of things.
Yes. And I love that so much because I think that is really the beauty of the coaching piece of it. A lot of times when people just start our perimenopause and menopause trainings, they're like, I want to know all about how to test hormones and what foods I need to eat and things like that. But really, once you get into it, that skill set of learning to hold space without burning yourself out as a practitioner really helps lighten the load of doing your work, because you're helping your client actually realize there's a whole lot of things that she's worried about, that she's doing, that she's emphasizing, that we can now maybe let go or do less of. So talk about that a little bit. When you came into the program, what were you thinking you needed versus maybe what you learned? Like by the end of it, you were like, oh, this is really the secret sauce.
When I came into the program, like I said, I was really intimidated, and I still am. And I don't read labs. I don't read the Dutch test. I'm not trained in that type of physiological approach. I'm really trained in the nervous system. I'm really trained in understanding foundations of health. I can pick up all the information related to what are the hormones doing, and the shifts and changes in the neurotransmitters, and how those impact the body. And so I was really intimidated, because I still can sit in on some of the complex calls and go, I don't know, I'm not going to be able to prescribe that Dutch test, but I'll keep learning. I'll keep learning, and I'll build people that I can refer and build collaborations with.
Well, and I think that's an important point really quick, that you don't have to have the scope of practice to do 100% of what you
Yeah.
learn. Sometimes the trick is, even in my physical therapy training, we learned all about pharmacology. We had a whole pharmacology course. I've never once prescribed a medication. It's not in my scope of practice as either a physical therapist, nutritionist, or health coach. And yet, having that understanding is so important, because you are the path. You're the one person on the team as the coach who's slowing down and really helping your client make sure when she goes into her 3-minute appointment with her gynecologist, she asks the right questions.
Yes, and can be organized, and can already have some information about herself, about what are the steps I've tried, what are the things I'm aware of, what are some key talking points, because you're right, it's probably going to be like a 3 to 5 minute conversation. And that's really what excites me about starting to be able to do coaching. I found, for me, I came up with this acronym of, I'm calling it RADIANT, which I really like, because it's just about brilliance, and light helps with everything. So it's really about recognizing body signals, accepting what's happening in your body, learning how to nurture your body, how to integrate it, and use integrative holistic tools, and so being able to bring kind of simple principles together that are looking at all the foundations of health, and to start bringing in some accountability, because that's so much of the game. And I've, worked with a couple of different health coaches, and that's been very helpful for me and in some of the health journey that I'm dealing with. So.
And this is, I think, one of the most important pieces of the work that we do as coaches. Your client could have, let's say, 5 years in the future, and AI could spit out do this, 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 and this. Someone could give that to you. Someone could give that to me. We're not going to do it without that support, that accountability.
Well, we need that for our feedback loops.
100%.
Because if we don't have a co-regulated new feedback loop, the brain's not going to want to learn new information. What it's going to do is go back to its autopilot pattern, because that's how we're designed. We're designed to be very efficient. So we need to have that accountability aspect, not just the informational aspect, because that's how we make change.
Yeah, I think that's so important. That's literally how we as coaches get our clients to rewire their brains, their nervous systems. And so they need a human. We're social primates after all.
Yep.
So, oh, I love that so much. So if you had a colleague in mental health, one of your colleagues in marriage and family counseling, social work, any kind of therapy, would you recommend the perimenopause and menopause training, and what aspects you think are going to be most exciting for them?
Oh, I would absolutely recommend it. I think you learned so much. I've learned so much in the program. Um, it had so many different components. I mean, even the business piece, like, because we're never taught business, same as I'm sure with, and I think you talk about this in your practice. It's like, hey, I have this degree, hang my shingle, we're good. So even the business, the business portion. So being able to speak to having kind of a protocol or a model. It's not a protocol like we do in EMDR where it's very stringent, but a generalized protocol that, gives us a roadmap in understanding the whole arc of the transition and what's going on, as well as looking at the rest of the body of, how does this system communicate with another system, that makes this beautiful human. And, you know, and and she has a unique life. Yeah. So I think it was an amazing program. I would love to have a program, in mental health that's very similar, but we'll get there. We're always a little behind.
Oh, well, and we have many, many mental health professionals in our community and in our programs, and we welcome even more because I think the core part of it is that idea of nervous system regulation, holding space. Like this is something where it's easy for you to understand at the entry point. And then you get to go deeper into, in very few mental health traditional training programs, do you talk a lot about how there's communication between the gut microbiome and the brain, the vagus nerve communication that's bidirectional, the immune system communication that's bidirectional. That's the stuff that gets me really excited for mental health professionals, even musculoskeletal. We now know that the muscles are an endocrine organ and they speak to the brain.
Yep. And so the brain's telling you so much. What's coming out and being named is sometimes telling us about a mental health or a trauma or has different roots. A lot of times it's communicating what the body, we all know about that bidirectional signaling, it's saying a lot about what's going on in the body.
And the other thing I love about having so many mental health professionals in our community is that I think there's, collaboration among mental health professionals, physical health professionals, people that have more of a background in traditional and conventional medicine, such as physical therapists or dietitians, with mental health professionals, with our more holistically initially trained practitioners, such as the acupuncturists in our community or herbal medicine practitioners. So I love to see such a diverse community that we've built over, now this company has been in business over nearly 20 years. So you see that collaboration. And I do think that's something that's really happened in healthcare in general in the last 15 to 20 years since we've been talking about this, is that people are very collaborative and they are starting to break down some of those barriers. Now, the system makes it tricky, but I do think that many, many, many more individual practitioners are helping their clients build those teams, breaking down those kind of siloed barriers. And it sounds like you're really doing that in your practice, even if you're not prescribing or recommending a Dutch test. You're working with people who do, you understand what the test is, what it's measuring, what different practitioners could utilize that for. And so that's why I've oftentimes been challenged, it's been recommended to me that I need to have like different levels of the program for different practitioners. But I actually think we all need to know it all, even if we're not doing it all.
Yeah, because we learn how to hold more conversations. We expand, we grow.
Well, Thank you so much for sharing your journey and your practice with us, Julie. I think, like I said, I encourage so many mental health professionals to join our community because you have so much to offer. And the thing about perimenopause and menopause is I really do think that for many women, the first symptom that's bothersome enough for them to actually start taking action in their own health and self-care are often the mental health symptoms, the depression, the anxiety, the sensation of rage, the burnout, the overwhelm, brain fog even. So you guys sometimes are really the frontline
We really
first
are.
provider.
And we're not always educated in it. And just to give an example of that, last week I randomly got a call, and the woman was, in her mid 50s and very high functioning, et cetera, et cetera, et cetera. And just in that intake call, I'm like, what's going on with your menopause? And they're like, you were the very first person to ask me that question. Yeah. And they had called around quite a few places. So we need to be talking about this, and asking some of these questions. It's so powerful for women.
Yes. Thank you so much for everything you do. Tell us who you work with, how people can reach you, because, I certainly would love to be one of your clients. I can tell already your energy is so wonderful.
Thank you. I love what I get to do. So as a therapist, you can find me at juliecardoza.com. And as a coach, you can find me at heartscapesllc.com. And you can follow me on social media. I gave the links and will be in the podcast notes. And I try to talk about all kinds of things, polyvagal theory and all these integrative concepts. And I also work as a consultant. So if people are looking for either EMDR consultation or trauma-informed consultation or midlife menopause consultation as a practitioner, I also offer that as well.
Excellent. Thank you so much, Julie. We'll definitely share all your information in the show notes so everyone can be in touch with you who's interested in learning more about your work. Thank you for sharing your experience, and thank you for being such an important part of our community over here at IWHI.
Thank you. I really enjoyed the program. So thank you so much for all the work you've poured into that.
Thank you.